Good evening. I'm Dr. Richard Johnston, and thank you for attending tonight's event. I so much wish this could have been in person and we could meet each other for the first time for many of us. I've been involved with One World Surgery for approximately 3 years. I first attended a SCA One World Surgery event in 2017, and I was amazed at the passion and energy all the volunteers showed. I'll never forget going to the NPH facility, Nuestros Pequeños Hermanos, and seeing the care that was delivered to those children. I also attended a surgery, and during the recovery of this 70-year-old gentleman who had a hip replacement, he had a huge smile on his face coming out of recovery. And I asked the nurse what type of pain medicine he was getting, and she said simply Tylenol, and that's what he would go home on. And the surgeon walked up behind me and said, "This gentleman has been working in the fields for years with severe pain in his hip. This is nothing. He's just so happy to, for the first time in many, many years, to be pain-free and be able to go back to work." There's many, many stories of the missions and the patients that have been encountered during these trips in both Honduras and Dominican Republic. All of them are impactful. I want to thank our sponsors, Rubicon, Brassfield and Gorey, SCA, USMD and WellMed, Texas Health Resources, Flower Mound Surgery Center, Climate Evangelist Eye Centers of Texas, as well as to all of our physician partnerships. This is a fundraising event, it's a charitable event, and I want to tell you, this not only impacts the people we serve, but also those who serve. This is a very meaningful event, and everything we do is going to have an impact on people's lives. I'd like to now turn it over to Caitlin Zula, CEO of SCA, and Dr. Wyatt Decker, CEO of Optum Health.
Good evening, Texas. My name is Caitlin Zula, and I am the Chief Executive Officer of Surgical Care Affiliates.
Hello, Texas. I'm Wyatt Decker, the CEO of Optum Health.
We'd like to welcome you to an event that celebrates a mission that is near and dear to our heart. We are so grateful for the incredible work that's done by One World Surgery and for our teammates in the entire Dallas community for rallying to support One World Surgery and our neighbors in Honduras and the Dominican Republic during this unprecedented time.
Together, we are helping to change lives for the better. It's unbelievable, the compassion and the service that we see across Optum, across SCA, and in One World Surgery. And as you know, now more than ever, the people that we serve through One World Surgery are people that are truly in need.
This year has been unique and challenging and certainly unlike any before. And we are deeply grateful for all of the incredible people who have risen to the challenge to help us transform lives.
One World Surgery team's incredible commitment to serving communities that have historically been marginalized and have great challenges accessing medical care is something that I'm very proud of and deeply committed to myself.
SCA has had the privilege of partnering with One World Surgery over the past 6 years. And through that journey, we have learned the power of partnership, thoughtfulness, community, and compassion. And over the past few months, we've also learned the power of having a sustainable mission. Our teams on the ground in Honduras and the Dominican Republic continued to see patients during their time of need. Not even a pandemic could stop them.
As our organization has seen the support and partnership between SCA and One World Surgery continue to grow and serve people in need, we have become deeply committed and today are very proud to be a part of the launch of the primary care center in the Dominican Republic.
We continue to be reminded that doing good enriches the lives of those who we directly serve and also us in our jobs. And while we may be stateside for now, there are still ways that you can help the global community.
To all of you who've taken the time to join us tonight, thank you. Your heart for this work is invaluable.
Now let's hear from the heroes themselves, Dr. Merlin and the team in Honduras.
Howdy from Honduras to our Texan friends. Good evening to everybody who is attending this meeting tonight. I would like to say thank you for joining our meeting, to all the Texan mission members, to the ones that I haven't had the pleasure to meet in person. I would like to introduce myself and say that I'm Merlin Antunes. I'm an orthopedic surgeon. I'm the medical director at the surgery center down in Honduras. I've been involved with the mission since the very beginning. And as a matter of fact, I grew up in NPH in the campus long before the surgery center started. One World Surgery is so special to me, and now more than ever. The pandemic has hit hard our country, and our patients had needs and their difficulties before the pandemic, but now it has just gotten worse. It is so expensive to look for healthcare in nowadays because there's no transportation, the economy is down, and the lockdown of the country. But our team never stopped. We continue seeing urgent cases, we continue supporting NPH, and we found creative ways to continue our mission. Now we're back, we're doing surgeries a couple of times of the week, we're seeing patients in clinic. Our resilience has just become stronger. Perhaps one thing that has struck me the most is the fact that I have scheduled more amputations than I usually do. And part of this is because it is faster, and in a situation like we're going through, we need to fix things a little quicker. In the beginning of the pandemic, we just didn't know how we were going to get to today, where we're back in clinic, seeing patients, and also being able to do surgery. I totally felt out of my comfort zone. I love doing surgery, and I miss doing surgery and helping my patients. This isn't exactly what I had dreamed for year 2020, but our mission has always been unique and has led to incredible stories of transformation. And I'm reminded of this when I think of Yerlin's story and how our Texan friends in Flower Moon step up and help her. She had a condition that we couldn't totally fix at our center because we just didn't have the right implants. So we had the chance to just do part of the surgery, and then she went to your place. And perhaps the one thing that amazes me the most is not just the fact that she went there for care, but the fact that you treated her as a family member, and she's got a lot of friends over there. Now she's back at her place, and she's the patient receptionist. And I think that, if I think of who can help our mission and our surgery center to take better care of her patients, she will be the one because she has walked the walk. Thank you for listening tonight of the ways that our team has stepped up to serve our patients through the pandemic. I hope to see you guys sometime soon down in Honduras. I'm very honored to introduce you to our team in Dominican Republic, who are also replicating what we have done in Honduras.
Hello, thanks to the Honduras team for the presentation and for the wonderful work you guys do every single day. My name is Darren Ablovi. I'm a pediatrician from Northwestern and also the medical director of the One World Surgery Dominican site. And I'm here with Dr. Jomari Miller, our first local physician, and I'd like to welcome you to the Dominican Republic One World Surgery Fireside Chat.
Yes, thank you, Darren. Yes, I'm Dr. Jomari Miller. I was born, raised, and formed as a physician here in the Dominican Republic. So all I know is this weather. I was trained as a physician in the Universidad Central del Este in San Pedro de Macorís. So everything I know is this Caribbean weather. So, and you mentioned something about the fireside chat. What is that?
Well, Jomari, in parts of the world where sometimes it dips below 100 degrees Fahrenheit, we like to make fires to warm ourselves up by. But here in the Dominican Republic, we prefer the fan side chat, although our fan isn't on today because the power's off. But in addition to the difference in temperature, there's a vast difference in the access to medical care that our neighbors here have when compared with what we're used to in the United States. When I was back in the NICU a couple weeks ago in Chicago, everything that I needed to take care of the babies, like a breathing tube or oxygen, was at my fingertips. But here, when we were able to help a gentleman get his femur and tibia fixed that he had broken in a motorcycle accident, we actually needed to go to the store and buy the rods and the screws that the surgeon used to fix them. Not only that, for the blood that he needed for a transfusion, we needed to buy from a street vendor, and it delivered the 2 units of packed red blood cells in a paper bag, which were stolen at the hospital. So these are some of the challenges the patients here face when they're sick or injured. From my days in the Peace Corps and working in global health since then, I've always noticed that sustainability is the most important aspect of a global health intervention. And so that's why I'm honored to be able to work alongside a local professional, Dr. Miller, who's demonstrated compassion and dedication to the patients that we treat in the Batays so far.
That's right. As Dr. Darren says, it's very involving when me as a part of this community, I can talk through what their living situation is. The socioeconomics are very low. So to have more an idea Bateys or sugarcane towns are these communities outside of the city where people are mainly land workers and housekeepers, and they actually have these socioeconomic struggles every day. So basically they live in day to day, and they have sometimes choose between go to the hospitals and figure out what's going on with their bodies, or just skip that day and bring food to their families. So they don't have the privilege to have both. So that's why I feel more than blessed and privileged to be working with the One World Surgery and be part of this mission as for my country, for my people, and I serve to them, work with them. And actually, are we supposed to be drinking some coffee right now?
No, Claire told me that I'm not allowed to because I'll start sweating. These monks are just for show.
Got it.
When we first went to the NPH Honduras home, it wasn't a standard medical mission opportunity. It was really just a service trip. Reinhardt, who runs the NPH Honduras home, had a young girl in his home that he couldn't find help for. And he said, we have a little mini surgery center in the back of a converted semi-truck trailer, and why don't you just do some surgery and fix her in the semi-truck trailer while you're here. Just take care of it in an afternoon or something. Obviously, he had been ill-advised as to how big of a project that would be medically and surgically.
So Angela came back with us and my other children. I have 4 other children, and she lived with us, and Peter did the corrective surgery on her, and she stayed and recuperated and rehabilitated at a house for a year.
They received me with ice cream, cake. I love ice cream since that day.
I watched her as she worked through all the hardships and the surgeries and the recovery.
I thought that I will be forever in the wheelchair. Yes, I want to play soccer. I want to run.
She truly became a part of our family. She became a sister to me.
After being with us for a year, we had to bring her back to the home, and that was really hard on everybody.
I was really sad to live, to let go.
In the morning we were leaving, I brought her to school, and we were saying goodbye, and she went into the classroom, and then she came back out, and she said, "Mommy, stay with me."
I asked her to stay here with me.
I turned to my husband and said, "Do something," and that was the beginning of really One World Surgery.
I don't know how it will be if I didn't ask her to stay.
If it wasn't for Angela, thousands and thousands of people wouldn't receive the care that they received with One World Surgeries.
That's why it's called One World Surgery, because it takes one person to change the world.
It's Michael. So big.
My mom called me and she told me that my sister Trisha was having problems in her pregnancy, and she told me all about it.
When I was 20 weeks pregnant with our youngest son, Michael Patrick, we found out at my 20-week ultrasound that he had multiple life-threatening conditions. I was immediately put on bed rest and was told that I'd have to stay on bed rest for the rest of my pregnancy, and I had to figure out a way to care for my other 4 young children, ages 6, 4, 2, and 1.
I asked her, "Mom, how can I help you?"
I was very reluctant to accept help from anybody, and I didn't want just anybody to come into our home and care for my children when I couldn't.
I came back and helped my sister to take care of her children, just like I do on the ranch.
And it was in that moment that I realized my prayers have been answered. God wasn't just sending me anybody to come into my home to help. he was sending me my family.
He's a handsome boy with blue eyes. I love it, seeing his smiling.
That's, again, another inspiring thing about Angela, that she's got that kind of caring in her heart. She's doing that now for us and giving back to us, which is just humbling to me. It's beautiful. It's just a totally beautiful thing.
I feel like I am connected with him because, and the way that we had surgery, he had surgery, he has pain, I had pain. It's like for full circle. They help me. Now it's my turn to help them.
We are all a part of one world, and we are called to give back to those within our community, within our world, to make this world a better place.
Good evening. My name is David Evanek. I'm an orthopedic surgeon here in Flower Mound, Texas, just outside of Dallas. My involvement in One World Surgery started approximately 5 years ago. The thing that I think of most when I think of Honduras is all the smiling faces in the recovery room. There's not many people complaining. There's not many people in pain. They're just relieved that they got some of their life back. That is something that I don't know anyone who wouldn't want to be part of that. We were very humbled and grateful to be able to participate with Merlin and his team down in Honduras. We're looking forward to the next time we go. We're very sad that we missed this year's brigade due to COVID, but we're looking forward to starting again next year. We're already in preparation to come down next June. Hopefully all will be well and we can come back to this wonderful country of Honduras. And for all of those out there considering going down, who wouldn't want to be a part of someone else's miracle? Thank you for your consideration of One World Surgery, and thank you for all your prayers. God bless.
Hi, I'm Brian Damari, Senior Medical Director for USMD and WellMed Medical Management here in DFW. And I've been asked to tell you a few things about my involvement with One World Surgery in the campaigns that One World has in the Dominican Republic and Honduras. I was blessed to meet a young doctor who worked with me one of the days, Dr. Jamari Miller. She is an amazing individual who has this joie de vivre for life, but also for medicine. The people are just amazing, and I can't tell you how good I feel afterwards. And it's exactly what I prayed for, and I think what I got, and I hope each of you can join us in your own time and get to experience such a wonderful thing.
Thank you, One World Surgery.
This is very special, and I'm proud to be part of it.
Thank you for all that you are doing, especially in this unprecedented time.
So obviously there are a lot of good memories, but the one that comes to mind for that is teamwork.
Everybody coming together and helping out others while doing what they love and enjoy.
My favorite part is truly just seeing a patient smile.
We've been able to help so many people, and I just look forward to all the patients we're going to be able to help in the future.
It gives us a one world view.
It's all about bringing in these passionate people.
When I grow up, I want to be a doctor.
I cannot even begin to fathom how many more lives we will be able to transform and serve as our project continues to expand.
One World Surgery to me means making a commitment to the communities we serve.
We love you, One World Surgery.
One World Surgery means hope and compassion.
One World Surgery is giving opportunities to those in need. One World Surgery is the light at the end of the tunnel.
One World Surgery means to me love and service.
The impact of One World Surgery is change families' life.
One World Surgery means to me love and hope.
There's a lot of ways that people can be transformed. And seeing the need in the people here and the look in their eyes and changing that look of desperation to a look of hope. Everybody feels that.
como yo hay muchos, seguro. Tengo mucha habilidad, pero tengo necesidad. Estar aquí sentado es difícil. Sin poder hacer nada, es muy difícil. Pero hay que tener buena mente para no caer en depresión. Necesito cirugía, es muy costoso. Si yo caminara, fuera otra persona y fuera bien feliz.
One World Surgery has grown significantly over the past several years. More than 1 billion people lack access to surgical care. We know we have a program that can meet that need, and now we're bringing it to the Dominican Republic.
We're already out working in the community as we've launched our primary care medical missions, and we learned that the need is far more tremendous than we ever anticipated.
We are committed to the success of our program in the Dominican Republic. In fact, our CEO moved her young family to the Dominican to personally ensure its success.
We have the opportunity to make a tremendous impact, and we're going to do it.
It is so special that we can get out and go interact with the community that so desperately needs our help. To be able to go into the TAs, meet the patients, and then take that back to figure out what needs we can serve both on the surgery side and the primary care medical mission side.
Datua likely has a condition called Blount's disease that he's been suffering with since he was a child, where the growth plates fuse on one side of his knees but not the other. He needs bilateral knee replacement so he can walk straight, and the longer we wait, the more challenging it'll be.
We started One World Surgery to try to address a global health crisis. It began in a semi-truck trailer and now consists of the state-of-the-art surgery center here in Honduras. We have a friendly visitor center that houses 70 people, a conference center for 300 people, 40 full-time employees here on our local staff. And in 2019, we had 29 brigades that served 10,000 patients. I've never seen compassion displayed like this.
The surgery doesn't end when I put a rod in or a plate in. It ends when the patient is healed. We have a local Honduran staff that manages follow-up care.
Because we've got so much demand, we're establishing a second site in the Dominican Republic. We want to build capacity in the countries that we serve. We're not just kind of coming and going. We have that constant presence. We've broken ground with the surgery center and the primary care clinic.
We've learned so much in Honduras over the last decade, and we know now we have the model to make an unbelievable impact here in the Dominican Republic.
When you restore that hope and you change that one person's life, you change that whole family that that one person exists in.
We've seen the need, we've seen the impact, and we've seen that we're able to do this and grow. And so we need to keep going.
Welcome to Dominican Republic, Dallas. My name's Claire Cunningham, and I have the privilege of serving as CEO of One World Surgery. I'm standing here where we're building our future surgery center, our primary care clinic, and our visitor center. I can't wait for each of you to walk these grounds and meet our neighbors at the Patay, which historically is a sugarcane laborers settlement. Just like in Honduras at the Holy Family Surgery Center, the energy and the buzz here is just palpable. It's because of what this represents for the future. Now, it's hard to think back to 2019, but it was our most impactful year yet. We served over 10,000 patients. We served over 1,400 surgeries. Oftentimes, our patients were waiting over 4.5 years for these surgeries. Over 32,000 volunteer hours made this possible. We launched an integrated primary care program, and we started in our second country of operations. Each of these numbers represents a story, a journey of our patients fighting for a better future for themselves and for their families. And this was only made possible because of supporters like you. And I can tell you, we need your help now more than ever. This crisis is magnifying the inequity in global health. The Gates Foundation just recently published their annual report that said we've been set back 25 years in just 25 weeks. Think about that, 25 years in 25 weeks. But we still have time to make up for this lost ground. How the world responds, what we do tonight, can make all the difference. Compassion is an OWS value, and Dr. Daly often reminds us it literally means to suffer with. It's difficult to articulate the pain, emotionally and physically, of poverty, the backbreaking work of sugarcane workers, the formal and informal work of women. Research shows that women and children are the ones who suffer the most. I will also share it's such a gift to witness the fierce and resilient spirit of our patients, our neighbors, our friends. It's why our volunteers keep showing up again and again. So let's stand in solidarity with our patients. Compassion is empathy in action. Thank you for giving from the heart. $250 provides 5 patients chronic disease medication for 1 year. $500 provides 10 cases of personal protective equipment. $900 provides 1 life-transforming surgery. $5,000 can provide up to 3 months' salary for a local physician. And $10,000 can perform over 11 transformational surgeries. I want to thank our sponsors who made tonight possible. Our platinum sponsors Rubicon, Breastfield Gorey, Kleiman, and Evangelista Eye Centers of Texas. I want to thank our physician partnerships for continuing to give in such a meaningful way. And SCA, Optum, USMD, WellMed for making all of this possible. Thank you so much, Dallas. We're so grateful for you.